Did you know that at the start of 2024, students in the 8th and 10th grades will be questioned about using something called Delta-8? It doesn't stop there though. Other illegal drugs, except for marijuana, have been used steadily without significant increase or decrease by all 3 grades surveyed. The numbers say it all: 4.6% of the 8th graders, 5.1% of the 10th graders, and 7.4% of the 12th graders admitted to using illegal drugs, other than marijuana, in the past year. In this video, we will explore the impact of substance abuse on teenage mental health. So, stay with us till the end because it's them today, but they can be your child tomorrow. Even though a lot of kids and teenagers are perfectly healthy, some are more likely to engage in actions that can harm their health, like using harmful substances. It's actually quite surprising because many grown-ups who are now struggling with substance abuse began using these harmful substances while they were just teenagers or young adults. Kids and teenagers who use such harmful substances often find themselves dealing with more physical and mental health issues. Not only does it worsen their overall health and happiness, but also it could lead them down a path to addiction. When kids start misusing substances like drugs, they often find themselves wrestling with a bunch of problems. They might find their schoolwork getting tougher and their grades starting to drop. Not only that, but they could also face health issues. And by health, we're talking about their mental well-being too. Interacting with friends might start becoming a struggle, and to make matters worse, they might even get into trouble with the law. Just imagine, these are teens who should be out playing or working on their homework, but instead, they're dealing with all of this. But it's not just the kids dealing with these problems. Their families, their neighborhoods, heck, even our whole society bears the brunt of their substance misuse. So, it's a bigger problem than we think, and it's about time we addressed it together. Academics? It's no secret that substance abuse during teenage years can lead to some major problems. Things like falling grades, skipping school, missing out on other stuff, and even the risk of leaving school altogether. You see, studies show us that kids who don't value their education and miss school a lot have a connection with substance use. Using alcohol and drugs can cause issues with thinking and behavior in young folks. This can mess up how they do in school, and at the same time, it can make learning tough for their classmates too. Mental health? Substance abuse doesn't only impact academic performance, but also takes a toll on mental health. Teenagers who engage in substance misuse may experience increased anxiety, depression, and mood fluctuations. For many, these substances initially serve as a coping mechanism or escape, but they can quickly become a source of heightened stress and mental unrest. The vicious cycle of using addictive substances to numb unpleasant emotions can exacerbate underlying mental health conditions, making them harder to treat. Teenagers struggling with addiction might face social isolation, feeling misunderstood or stigmatized by peers and family members alike. This isolation can further deepen feelings of depression and anxiety, creating a challenging environment for recovery and support. Understanding this connection emphasizes the importance of early intervention and comprehensive mental health support for teenagers dealing with substance abuse issues. Teens who use drugs or alcohol often face more danger than those who don't. They can struggle with extra mental health issues. This might include having trouble behaving properly, certain personality disorders, feeling like they want to harm themselves, or even trying to take their own lives. A common drug among kids, marijuana, can affect their ability to remember things in the short term. It can also mess with their learning and their physical coordination. Moreover, it can impact their motivation and their emotional growth during the key teen years. Delinquency? Delinquency is using substances inappropriately, like alcohol and drugs, and behaving badly or breaking the law. These things often go hand in hand in young people's lives. Imagine a train. One carriage is the bad behavior, and the next one is alcohol or drug use. They move together down the tracks. Many teenagers who engage in unhealthy habits such as drinking too much alcohol or using drugs end up clashing with the law. It doesn't necessarily mean that if a kid uses drugs they will start acting badly. Or if they behave poorly, they will definitely start using drugs or alcohol. It's not a clear-cut cause and effect thing. It's kind of like saying eating ice cream causes sunburns just because more people eat ice cream and get sunburned in summer. These two behaviors often show up together. They're like two peas in a pod, and they can cause a whole bunch of other problems. These can include troubles at school or home, hanging out with the wrong crowd, not having enough good role models in the neighborhood, or even going through bad experiences like physical or sexual abuse. According to a survey, in every high school classroom, roughly 15 out of 100 students have admitted to trying certain dangerous drugs at least once. These aren't your typical over-the-counter medications. We're talking about stuff like cocaine, inhalants like glue or gas, heroin, methamphetamines, hallucinogens, or ecstasy. But that's not all. About 14 out of every 100 students also admitted to misusing prescription painkillers. These are medicines that doctors usually give to people after they've had a major injury or surgery, but some kids are taking them without a doctor's direction. Now, why is this a big deal? When teens use drugs with a needle, like heroin, they put themselves in direct danger of getting HIV. This serious disease hurts their immune system, and it's not just the needle users who are at risk. Any form of drug misuse can lead kids to overdose, which can make them extremely sick or even cause death. Why teens are more likely to get addicted. Ever wondered why teenagers are more likely to fall into the trap of addiction? Several studies exploring the human brain have tried to answer this question. They found that our teenage years are full of rapid physical and mental growth. This is a crucial time for our development, and unfortunately, harmful behaviors like substance abuse can really mess things up. When our brains grow, different parts mature at their own pace. Interestingly, the fun zone of a teenager's brain, where they feel good, develops quicker than the parts that help make wise choices and judge risks. It's common knowledge that teenagers can be thrill seekers, sometimes without understanding what could go wrong. It is during these challenging growing up years that experimenting with drugs and alcohol often peaks. Teenagers tend to believe that drug use will make them popular among friends or help them socialize better. They often don't stop to think about the harmful effects. If you're worried about a teenager you know who might be struggling with substance abuse, don't hesitate to reach out to a professional for guidance and support. Parents and educators play crucial roles in addressing the challenges posed by teenage substance abuse. Open lines of communication can serve as a preventative tool, allowing teenagers to express their feelings and concerns in a safe environment. By understanding the root causes and triggers of substance abuse, both teenagers and caregivers can work together to build resilience against these pressures. Initiatives such as school programs, counseling sessions, and community support groups can provide additional layers of support and act as buffer zones in potentially chaotic teenage years. So that's a wrap. We hope you liked the video. If yes, don't forget to give it a thumbs up and subscribe to our channel for more thought-provoking content.